For the first time this morning, we are going to learn about the coronavirus from someone who is right now being treated for the coronavirus. One of the passengers on board the Diamond Princess, who was confirmed as a coronavirus case, taken off the ship and now receiving medical care in hospital in Tokyo. I'm going to introduce you to Rebecca Frazier now. She's from a town just outside Portland, Oregon, Forest Grove, Oregon. There she is, live with us from her hospital bed. Rebecca, I'm just delighted to welcome you to the program, and we can't wait to hear the story you're going to tell. But good morning and welcome.
Good morning, Heather. Thank you for having me on.
Listen, as I look at you, I'm thinking Rebecca Frazier looks pretty well. How are you, Rebecca?
I feel pretty well. I never really had any symptoms like cough, a slight fever when I arrived on Friday to the hospital. Both of those have since resolved. I haven't experienced anything else, so I'm very thankful for that.
Meanwhile, you're still in hospital, and we'll get to the certain, the current conditions in just a second, but take me back to where this whole story began, because we're very intrigued. As I said, we've never spoken to anybody on our program with coronavirus. So were you showing any symptoms? How did you even know you were sick?
Yeah, so basically, once the ship was returning to Tokyo, we learned about that first case from that passenger who disembarked in Hong Kong. As a result, they had the Japanese Health Ministry board our vessel. They did test all of our temperatures that first day. They also passed out a questionnaire in which you would indicate if you were feeling fluish or had been to those regions of China that were affected, as well as taking painkillers. My husband and I did mark that we take painkillers, Advil, Tylenol, things of that nature. Mm-hmm. And as a result, we're then additionally targeted for an additional throat swab, which is how I tested positive. My husband tested negative.
Otherwise, you might not have known. I mean, what does it feel like? What did it feel like in your case, this sickness?
I mean, it feels physically, I don't have any symptoms. I would have never known had I not been randomly chosen.
Okay.
Just because I marked that I take, Advil on occasion.
So not even feverish, not even coughish particularly? Nothing unusual, Rebecca?
No, I mean, not really.
Okay.
We had been out and about outside. We had taken a tour in Taiwan. And, after that, I had a little bit of a cough, but I figured, it's just because I had been outside and, in a boat. So nothing to worry about. I don't typically worry about those things too terribly much unless, it becomes acute. And then,
and yet,
then there's
and that there's a swab and you test positive for this coronavirus, which, as you know, is, it's deadly in some cases for people, but it's a big mystery, so everyone's rather fearful of it. To hear that you had, even though exhibiting hardly any symptoms, you had tested positive, what was your reaction to that?
I was really dumbfounded, really, when I heard. I heard on Friday morning, a member of the cruise staff came to my door along with a health official. The cruise staff was there to basically translate the information to me in English that I had tested positive, that I would need to be removed from the ship and go to a hospital locally. My husband would have to stay on the ship and wait out his quarantine. And I would be taken within a couple of hours to do all of this. So it was definitely a whirlwind. I was completely shocked. You just never think that something like this is going to happen to you, let alone, on vacation that was supposed to be amazing.
Yes. And so there you are, about an hour and a half or so outside of Tokyo, outside of Yokohama, where you were on the ship, where it is in port, in this hospital. And as we talk, can you show us, I mean, this looks like a Western hospital room to me. Is it a private room? Show us around and tell us where they're caring for you.
Yeah, so it is a private room. Here it is. Just take a little spin. I have a nice big window, so that's good. And then there's my door. There's a restroom over there to the right, and a sink here. And then behind me
And then
is
your
the bed.
So a pretty standard hospital room in isolation. You're there by yourself. And when we were just gearing up to talk to you on air, we were watching as a doctor came in and dealt with you. How are they caring for you? What are they doing in terms of looking after you and treating you, Rebecca?
Yeah, so basically they're just monitoring me. So monitoring my temperature multiple times a day, blood pressure, pulse, and listening to my lungs. Other than that, I've not received any additional treatment, no IV fluids, no IV medications, or other oral medications to treat, any sort of a flu or cold symptom. So basically, I'm just in the isolation, so not to pass it along to anyone else.
How would you assess the level of care?
I would say the level of care is good. Being in a hospital in a foreign country for which I don't speak the language has its challenges, but the doctors and the nurses are very caring, and they check in, make sure that I don't need anything. If there is anything I need, they are perfectly willing to, get that for me and to make sure that I am comfortable during my stay.
So you told me earlier your symptoms are not worsening, and that is good news. I'm wondering what you're hearing then as far as when you might be released, where you will go, might you go home, any of those questions?
Yeah, definitely. So right now I'm waiting. I have to wait 14 days from when I was first tested for an additional test. And so that has to be done twice, so 12 hours apart. Once those tests come back clear, then I can be released from the hospital to go home. So, or reunite with my husband and then go home. And then we'll have flights arranged in some capacity to head back to the States.
Because right now your husband is in quarantine still on board the Diamond Princess. Are you able to be in communication? As you said, there you are in a hospital where you don't speak Japanese. Are you able to be, and we're looking at a picture of the two of you together, to get information from him, to connect with him, as he too is in a state of uncertainty, I guess, on board?
He is, yeah. So we are able to communicate and connect. I have my phone here with me, so we're able to FaceTime and text throughout the day. And he is definitely, in a bit of a level of uncertainty being in the quarantine on the ship. That is supposed to end on the 19th, barring any unforeseen changes. So, there is some kind of light at the end of the tunnel. It's kind of far away, it seems right now, but we'll get there eventually and be able to go home and kind of regroup and refresh.
And reflect. I mean, I'm certainly hoping for his health too, because more and more people on board the ship are actually getting sick right now. Can I ask you finally, Rebecca, for this conversation, I'm wondering, we're talking about this, it's been our top story in the news for 4 weeks now, and there is a growing number of cases around the world, and there still is a lot we don't know about this coronavirus. But here you are, you're dealing with it. Mild case, thankfully, but you are dealing with it. I mean, what is your message to us as we talk about coronavirus?
Yeah, I mean, my message is that for all the people who are here in Japan, on the cruise ship, who have been tested and everything and quarantined, the government is making really sure that, nobody is leaving the ship, so nobody can spread this around to any of the public. And we won't be able to leave where we're at until they're sure that it's contained. So nobody needs to worry about us bringing it back, to Canada or to the States or wherever we're from. They're going to make sure that, we're clear before we can do that. And I think that a lot of people are scared that we're going to bring it back over the borders, and it's just going to spread rampant. And I think that the folks who, channel that, they're doing the best that they can to contain it and keep everybody safe.
Rebecca, I hope you continue to feel well. Wonderful to meet
Thank you.
Sharing your story, the first time we have heard from a coronavirus patient there, and it looks like you're going to have a few days of, well, quiet and maybe some boredom at times, but good health is the most important thing, and as we say, we're glad you're feeling well. Thank you for talking to us today.
Thank you so much for having me on.
Rebecca Fraser from her hospital room in Tokyo. First time on our network, as you hear, in the first person from someone who is being treated for the coronavirus.